A very good morning to all. I'm Dr. Swati Gupta, Deputy Secretary from CBSC, and I welcome you all the participants who have joined us through YouTube and Google link. Today we are going to have a training on medical diagnostic. It is a skill course that is being offered by CBSC in class 11th and 12th. So, medical diagnostic is a field which is increasing day by day, and it is market size is valued at US dollar 1.92 billion in 2022, and it is poised to grow at CAGR of 18.5% during the forecast period of 2023 to 2029. So this is a huge growth potential area where CBSE is trying to create more trained manpower to cater to this particular area. Also, NEP 2020 mandates that children have to be exposed to multiple areas, multiple skill from very early on in the school life. So, from through this course of medical diagnostic, students will be able to get into the world of medical science, and they can understand what are the requirements of science and medical field once they go complete their 12th and they want to go into medical fields. To understand more on this, today our expert is Ms. Dr. Vikas Gaur. He is assistant professor in Department of MLT, Mirabai DSEU Maharani Bagh campus of New Delhi. He has done his MSc in MLT, PhD in biochemistry, and has more than 10 years of experience in teaching and research. He is a member of American Association of Clinical Chemistry in USA, member of Board of Studies College of Paramedical Sciences TMU, and so on. So today now I welcome Dr. Vikas Gaur to please come and take up this session and train our teachers to be a good they are able to better communicate the nuances of this subject to the students in their class, and also motivate more students to become part of medical diagnostic and also pursue this course in the higher education. So with this, I'm going to invite Vikasji on this session, please. So
Thank you, ma'am, for inviting me, and thank you for giving opportunity to train teachers. I'm just sharing.
sorry. So if you're sharing your presentation, it is not visible.
I'm just sharing.
Okay.
Is it visible?
Yes, it is visible.
So, good morning to all. Today I'm taking classes of urine analysis. What type of urine sample can be collected, and in what manner we have to analyze of urine, and what is the objective of urine analysis. So these are objectives of urine analysis. Urine analysis is a test of urine which is normally produced by kidney and normally urinated by the every human being. And urine analysis that include various tests to examine the urine content for any abnormality that indicate a disease condition or infection. So in this urine analysis, various tests is examined can be examined. So any abnormality can be found which is correlated with the specific disease or infection in the urinary system. It is used to detect and manage a wide range of disorders such as urinary tract infection, either kidney disease and either diabetes. So we can detect a disease by the urine analysis, and we can monitor also the urine any disorder which is related to urinary system. It involves checking the appearance of the urine, concentration of the urine, content of the urine, and any abnormal urine analysis may point to a disease or disorder. In this urinary system, a pair of kidney and urinary tract, which include two ureter, urinary bladder, and urethra, Each kidney contains 1.3 million urinary unit, which is called nephron, and that is normal basic functional unit of kidney, which is used to filter the blood. And each nephron consists of glomerulus and urinary duct, bone capsule, proximal convoluted tubule, Henle loop, distal convoluted tubule, and collecting duct. The system is like that. So both side persist a kidney in left side and right side, and connected by the ureter, and all the urine which is filtered out by the kidney that can be collected in the bladder and which can be out through the sphincter through the urethra by time to time. This is the diagram of nephron. How produce the urine after filtration of blood. First, urine can be entered in the glomerulus area through the afferent arteriole, and it has high blood pressure. So, due to high blood pressure, all the filtrate can be passed out in the Bowman capsule, and remaining pure blood can be extract by the afferent arteriole, and filtrate urinate volume can be passed through the proximal convoluted tubule and Henle loop and through the distal convoluted tubule. Millions of Henle loop which open in the collecting duct, and all collecting duct are open into the ureter of the urine system. So this is the whole system which is produce the urine in, every minute. This is the normal composition of urine. You can see the difference between normal urine composition and abnormal urine composition. So we can detect any abnormality in urine that is related to the urinary system disorder or disease. So in normal urine system, water content should be 95%, urea is there, and creatinine, uric acid, electrolytes. All are the excretory product of the human system which can be excreted by the human time to time. This concentration can be low and high according to diet and habits of the human system. Abnormal urine constant may be found out glucose, protein, bile pigment, blood cells, cast parasite, and bacterial infection, bacterial microbes. These constituents may be found in the abnormal urine that is related to the urinary disorder or disease. A lot of factors which affect the composition of urine. Some factors diet and nutritional status. However, person take normal diet or maybe in fast condition. Second, condition of body metabolism. Lot of persons have different metabolism disorder, just like low BMI, high BMI, and that is related to the work profile. Ability of kidney function. A person ability of kidney function, just like kidney is doing work on the full work capacity or either 80% capacity or either 50% capacity. It relates to the ability of kidney function. In 24 hour, kidney filtrate 180 liter human blood. In out of 180 liter blood, urine form 1.5 liter only. Level of contamination with pathogenic microorganism or even non-pathogenic microflora, that is also affect the composition of urine. How to collect the sample and how the preserve of the urine sample for the better diagnosis. The urine must be properly collected in urine container, which should be proper sterilized. Disposable container of plastic coated paper are available in the many size and provided with the lids to reduce the bacterial or the type of contamination. It should be open mouth container and properly sterilized container should be there. So we can collect in the urinary container for the urine collection. There are a lot of type of specimen for the urine analysis, in which first morning specimen, that is a type of specimen obtained during the first urination of the body, so urination of the day. It can be most concentrated or most bladder incubated. It can be good for nitrate analysis, protein analysis, and for the microscopic examination. If a person need to test for the urine microscopic examination, we need to collect first morning sample, not the random specimen. So first morning sample after the sleeping, so need to collect. Second, random specimen, that is a specimen obtained at any time during the examination. So a person can go to the hospital and can take the sample at any time. That is for chemical screening and microscopic examination. So most preferable, it can random specimen is most convenient method, most common, that is most utilizing by the diagnostic centers and the hospitals. But first morning sample, which is most concentrated, and that is very good for the microscopic examination and as well as protein analysis. Third sample, third type of specimen, that is second wider sample. In this case, first morning specimen is discarded and the second specimen is collected and tested. So this type of specimen is good for reflection of blood glucose if we are observing or the diagnosing a patient related to the diabetes. So it is good for the second wider specimen. And second one, it is good for keeping of form element intact, which is chemically constituent of the urine. Fourth type of specimen is the postprandial. A specimen can be obtained after 2 hour quantitative analysis, just like during 24-hour urinary protein, especially for qualitative determination of protein. Specimen, midstream specimen is specimen which can be obtained from the middle part of the first urine. It is so in this case, what need to be done by the patient? Patient should be instructed by the person which is collecting the sample. Patient need to discard first few seconds of sample and then collect the midstream specimen of the urine. It is commonly used for routine urine analysis. Routine urine analysis. It is also important for bacteriological urine culture. So midstream specimen is best for any routine routine analysis, routine microscopic examination, or routine urine culture and sensitivity test. So these are type of specimen which can be decided by the person on the behalf of test which is referred by the physician. So on the behalf of physician report, we can decide which type of specimen need to be collected out of the 6 type of specimen. Either first, if patient came here for the test of 24-hour urinary protein, that need to be collected 24-hour urine specimen. If patient came from the glucose test, then can be obtained by the postprandial specimen, and most cases patient instructed to collect the midstream specimen and how to collect the detailed SOP which is provided by the laboratory professional to the patient. How to collect, this is the SOP you need to collect, and it should be explained in local language of the patient. So better to is this the best way of the better sample collection? Explain everything in the local language of the patient. This is the way in which you have to follow and you need to collect the sample. Clean catch urinary specimen, it can be used for microbial culture and routine urine analysis. When specimens are collected for bacteriological examination, they should be collected by the clean catch method and by the catheterization into sliced container. What is the catheterization? It is the process of passing a tube through a urethra to the bladder of the withdrawal of the urine. It may introduce urinary tract infection, but catheterization collection procedure can be implemented only in case of patient is admitted and he or she is unable to unable to sit from the bed. Maybe patient in the long lasting disease and he or she unable to stand. So in this case, catheterization can be applicable by the nursing staff or resident staff of the hospital. This is the procedure you have to follow for the 24-hour urinary specimen. To inform or direct the patient to completely empty his bladder and discard his urine exactly at the beginning of the 24-hour urinary time collection. That is 6 a.m. The first morning sample should be avoided. Collect all urine voided during the following 24 hours, including that voidedly exactly at the end of 24-hour period in the container 6 a.m. in the next following second day. So in this case, patient need to discard first morning sample at the 6 a.m. After that 24-hour, patient need to collect all the urine specimen in the given container with the preservatives, and next day morning first sample should be collected in the container. All the urine collected must be preserved. The container should be labeled with the test order, just like 24-hour urinary protein, 24-hour nitrate test, patient name, time of collection. Time of collection, just like today is the 1st September. So 1st September 2023 should be mentioned on the container. So 1st September 23 to 2nd September, that is time of collection. Preservative added, what preservative is added? Either fluorine is used, either formalin is added. So what kind of preservatives is added, that should be mentioned in the container of the specimen. How can we preserve of urinary specimen? Urine should be examined immediately as much as possible after it is passed. So it should be tested within a time, short duration. It is 2 hours. That is called test around time. TAD in short way we call is TAD. So urine should be examined within 2 hours of the collection, because some changes are occur after the collection of sample. Because some urinary component are unstable, so need to examine within 2 hours. So some of changes which are given below, that is long standing of urine at low temperature can cause, so growth of bacteria may be increased, breakdown of urea to ammonia by bacteria leading to an increase in the pH of the urine. This may cause the precipitation of calcium and phosphates. So a lot of changes will be occur. Oxidation of urobilinogen to urobilin, which is need to be examined. Destruction of glucose by bacteria. Lysis of RBC or WBC and CAS, which is possible in long standing of urine. We need to examine within 2 hours of specimen collection. Some there are methods of preservation of urine. How to preserve the urine in case the test will be done after 2 hours or 4 hours of the collection. First method, physical method, and second method is chemical method. In which first is the refrigeration, second is freezing, and chemical way we can use the thymol, toluene, formaldehyde, HCl we can use, chloroform we can use, boric acid, chlorohexidine, and sodium carbonate. These are chemicals we can be used for the preservative of a urine specimen. This is the summary of chart. There is a difference at what kind of advantage and disadvantage of preservation method. So first one, refrigeration, the which is temperature should be 2 to 6 degrees centigrade. So advantage there, no chemical interference after the refrigeration, but disadvantage there, it can be used for short period of time up to 3 to 6 hours. So for prolonged period, additional preservative must be used. So it can be used in case of for the preservation of the up to 3 to 6 hours. Freezing for specimen transport we can use, this is the advantage, but may destroy form elements, either RBC, WBC proteins, other cell cast part, they may be destroyed after due to freezing. Third one is the chemical way of preservation, which is toluene. Till it form thin layer over the urine, it preserve acetone, reduce substances protein. This is the advantage, and but disadvantage, toluene is a flammable, so it can be avoided. Thymol, which is mostly used, preserve most constant. So thymol, small crystal, what quantity should be added? Small crystal 5 mm diameter per 100 ml urine is added for the 24-hour urinary protein test. So it preserves most constant and it can cause false positive for protein, but mostly laboratory use thymol. Where thymol is unavailable, we can use chloroform, 1 tablet per for 60 ml of urine. It can be preserve urine aldosterone level also. So it, but disadvantage they are settled to the bottom of the urine container. It is settled down. Another preservative of chemical type of method, formaldehyde. It can be used by the 1 drop for 30 ml of urine. It preserves form elements, and but disadvantage there interference with glucose evolution. HCl is can be used, but in the dilute form, not concentrate form. 1 drop of dilute HCl is can be for sufficient for the 15 ml of urine. It can stabilize steroids and catecholamine, and disadvantages form elements are destroyed. If a test came for the catecholamine and steroid test of the urine, so we can add the HCl for the urine collection. Boric acid we can use another tab. Preserve, it can preserve chemical and form elements also, but it can precipitate uric acid. And sodium carbonate, it is another way of chemical preservation method. preserve porphyrin and urobilinogen, and but it interfere with the other urine constant. So we can select the preservation method on the behalf of test requirement. A patient came for the test for like urine routine microscopy, no need to add preservatives. If patient came for the urine culture, we can add the chloroform or thymol most suitably. If patient came for the catecholamine test, steroid and catecholamine. These tests usually done in the doping side, and every sport person who is practicing in the sport need to be tested by the National Anti-Doping Agency. In this case, we need to collect we collect the sample from the sports in the HCl sample, HCl preservatives, which is stabilized steroids and catecholamine. If a sports person is using any steroids or any type of drugs which can be tested by the urine test. These are the type of examination in routine analysis. The first one is physical examination of urine, and second the chemical examination of urine, and third one is the microscopic examination. So one by one we will discuss. So what is the importance of volume of urine? What is the color importance of the urine? Order, appearance of the urine. What is the importance of pH of urine? What is the importance of specific gravity of pH specific gravity of urine? And the most preferred chemical examination, which is glucose protein desiccant 2 test, which is most utilized by every laboratory. But nowadays, and other tests, ketones, bilirubin, urobilinogen, blood test, nitrite, leukocyte, melanin are also using by different diagnostic laboratories. These are parameters which need to be examined under microscopy examination of urine, in which first RBC, WBC, epithelial cells, cast, bacterial cell, yeast, parasites, crystals, and artifacts are there. These are categories of urine tests. According to their degree of accuracy, urine tests are grouped into three broad categories. First one is screening test. A patient came for a screening test, and only whatever is substance is present or absent, the results are reported as positive or negative. These are screening tests mostly suitable for the sport person or whatever a patient is suffering from any disease or also. So they need to examine the oxidative product or whatever substances present in the urine or not. Qualitative test, it can be determined accurately the amount of substances to be tested. So in this case, we can select the patient. We need to done the test for the qualitative test of the related to patient. Quantitative, these are usually reported in milligram per deciliter. The exact amount should be defined in the report, and we need to quantitate the report any substance which is present in the urine. This is the complete test for a 24-hour urine specimen needed. So any test which is need to define in particular manner in which with unit, either milligram per deciliter or either gram per deciliter or a gram per liter. So these tests are under quantitative test category. In first parameter of physical examination of urine, the first one is the urine volume. This is dependent normally up to the fluid intake or environmental condition, diet and activities of the human. If a person perform a lot of work in the ground, or a person who not work in the ground, so they may be differ the urinary volume, and the environment is also in humidity, and in winters urine volume may be increased or decreased due to conditions of the environmental condition. Normal condition, a normal value 1.5 liter per day can be considered a physiological. It should be combined with chemical and lab category examination. So what can be done, or what amount of urine is producing by human by the kidneys? So out of 180 liter blood is filtrate, and 170 liter 0.5 blood is utilized by the human, and only 1.5 liter filtrate it can be excreted as form of urine by the every healthy human being. If a person is producing not more than 2.5 liter urine in a day, that condition is called polyuria. Due to large, what factor can be what factor affect this condition? Due to large quantity intake of liquid, diuretic drugs, maybe a patient is taking alcohol, that can be done, and insufficient quantity of urinary duct sign absorption of water. You have seen the previous one, the proximal carotid tubule and distal carotid tubule. So they may absorb the water content of the urine. So this condition affect the polyuria condition. So polyuria may be defined if patient urinate more than 2.5 liter per day. Second one, oliguria, urine volume less than 400 ml. Maybe an abnormal condition is there. Anuria, that is a very rare condition in which a patient 24 hour during 24 hour a patient urinate volume of urine is which is less than 50 ml per day. It may be due to hot weather, more sweating, low water intake, or due to disease in kidney or urinary tract. Any changes in urinary volume is may be affected by the physiological condition or either pathological condition. It should be consult with the patient what is the his or her physiological condition is there. If physiological condition are okay, then all the factors can be related to the pathological disorder. Second factor, which is color, it can be observed in a test tube or urinometer tube. Yellow to amber first color, this is normal. The color comes primarily from the presence of urobilin in the urine. What is urobilin? It is a final waste product resulting from the breakdown of heme from hemoglobin during the destruction of aging blood cells. Destruction of blood cells, the urobilin formed by the liver and transported in the kidney, transported in the blood and filtrated by the kidney and excreted by the kidney. Second one is the colorless or pale yellow. It may be dilute form of urine with low specific gravity and polyuria condition. And dark yellow and yellow brown, which is more concentrated urine with high specific gravity but small quantity of urine, which is maybe dark yellow. And small brown and greenish yellow, yellow green form when urine is shaken, urobilinoid chromosome derived from heme green, which is form of biliverdin, yellow brown, bilirubin, and urobilin. These factors affect the color of urine, which is the normal destruction of the hemoglobin after the lifespan of RBC. This is a summary chart. There are a lot of type of color of urine we can examine and we can understand the disorder or conditions after the comparison of the urine color. First one, if urine color is a pale yellow, this is a normal color in which pale color you can differentiate between four parameters are there. And this is the bright yellow if patient is taking any vitamin B complex or B vitamin tablets or any vitamin D medicines are also there. The patient may urinate in this bright yellow color urine. If any patient is urinating red urine, there is a four type of appearance of urine: the low red, dark red, low dark red, or so factors may be affected. The blood may be urine and eating beetroot or blackberries. So eating habits also change the color of urine also. So maybe physiological and maybe pathological. If found blood in the urine, that is pathological. If patient taking beetroots or blackberries and due to this habit, patient is urinating in urine color in red, so that is physiological. After living second one is the orange. It may be due to dehydration, maybe certain drugs, medication, dietary factors, as such as eating lot of carrots. So these color may be found in the patient urine due to these kind of habits or these kind of state of person. Next one is green. Green urine may be found who are taking drugs containing phenol, maybe some anti-percent drugs, maybe dyes in food, just like jalebi or whatever, any dyes which is using in the food. So maybe found, maybe urinating in green color, maybe biliverdin, a bipigment, which is normal, and due to more number of RBC, due to more number of RBC and lysis, this pigment may be increased in the urine, so urine color may be found due to hemolysis of person. So certain infections also there. So there are a lot of conditions in which green urine may be found. Next is brown, certain antipsychotic drugs, certain antibiotics, certain phenytoin, dilation or sanatoid laxatives. So a lot of drugs which is taken by the patient. So patient may be excreted this kind of brown color urine due to this medication. Last one is the purple, which is porphyrin, which is due to taking of the porphyrin, a rare metabolic disorder. A lot of person, so these kind of colors of urine we can observe in the patient urine, and we can estimate if this person is affected by the physiological disorder or either a pathological disorder uh, after observation of urine color and after confirmation of this chart. Appearance. What is the appearance? Patient urine should be appearance should be clear. Freshwater urine specimen is normally clear and transparent. On long standing due to chemical changes that occur in normal turbidity sample, the patient is urine specimen is not clear. That is related to the pathological disorder and patient disorder. Specific gravity of urine. Specific gravity, it defines the ratio of the weight of fixed volume of solution to the same volume of water at specific temperature, usually 20 degrees centigrade. So patient urine specific gravity should be 1.010 to 1.030. Patient specific urine specific gravity should be in between normal value. If specific gravity is more than or less than, the urine constant may be changed. What is the pH? Importance of pH test of urine. A test that determines the acidity, neutrality or alkalinity of a solution. The pH indicate 7 is also neutrality. You also know about that. And if pH less than 7 indicate acidity, and pH goes more than 7 indicate alkalinity. Normally, freshly voided urine pH range from 5 to 7 in healthy individuals, but average pH is 6.5, which is low, slightly alkaline, slightly acidic. It is a test that analyzes acidity or alkalinity of urine sample. It is a simple and painless test, normal range as per condition. So what kind of disorder or disease can be seen in high urinary pH and low urinary pH? In high urinary pH, a patient has high urinary pH, meaning that it is more alkaline. It might signal a medical condition such as kidney stone may be there, urinary tract infection is there, or kidney related issue disorder are there. So if patient urinary pH is high, maybe alkaline, so this kidney stone is there, UTI infection is there, and kidney related disorder may be there. So we can estimate by the further test. Low urinary pH may be seen in the diabetic ketoacidosis, diarrhea, patient suffering from diarrhea, and patient is taking a fast or starvation. So low urinary pH can be seen in these conditions. Causes of acid or alkaline urine. So these are some causes in which in patient is vomiting, the urine may be alkaline, hyperventilation, vegetation diet, old specimen, renal tubular acidosis, urea is producing bacteria. So these are some conditions in which these are some causes. Due to these factors, urine may be alkaline. Second one is the causes of acidic urine, maybe diabetic mellitus, starvation, diarrhea, diabetic mellitus, the presence of sugar in the urine, starvation, long fasting. So due to fast, urine pH may be more acidic, diarrhea. In this condition also diarrhea, urine pH may be more acidic, dehydration. We are not taking properly fluid intake, so urine pH may be more acidic and maybe patient feel burn during urinating. High protein diet, emphysema, the low oxygen presence, acid producing bacteria. Some bacteria are present in the urine system which produce more acid. So patient urine is more acid, become more acid. Cranberry juice, medicine, some drugs are also there. These are some causes. Due to these causes, patient urine may be become more acidic. So first part completed. So in first part we completed volume of urine, factor, color of urine, appearance, pH and specific gravity we completed. Now we are going on second parameter.
Sir, just a second, sir. I would like to request the participants, since the first level has been completed. So if anybody has any queries, they can put it up on the YouTube chat box, and I will put it up to the expert. In the meanwhile, sir, if you want, you can take 2-3 minutes break. You can take a water break, and we'll wait for the comments on the YouTube, and then
Okay.
I'll invite you for the second levels.
Okay.
All right. So just let me check the YouTube. Please don't log out. आप अपना थोड़ा सा you can switch off your camera and your mic for 3-4 minutes. We'll come back at 11:05 or 11:06. So I would request all the participants to please start placing your queries or your comments on the chat box. The same thing we will ask the expert to reply. This will make the presentation little more interactive. So please go ahead and start putting up your queries. All right, sir, we can start with the second session. I don't see any comments on the chat box. So I guess your session has gone very well with the participants. So Vikas ji, please, we can start with the training. Dr. Vikas, if you can please come back.
Okay, ma'am.
Please start with the presentation. There are no comments on the YouTube chat box. So
Okay, ma'am.
your presentation is very clear. That is what participants are saying.
So second part of chemical analysis of urine, we can go ahead. So some factors, some parameter we need to examine. So first one, glucose, which is very important. Determination of how to determine the urine glucose, and what kind of causes of glucose glycosuria. It is the sugar most commonly found in the urine, although other sugars such as lactose, fructose, galactose, and pentose may be found under certain conditions. But normally glucose also found, which is normally human body normally utilize in the form of glucose. If you are taking any kind of carbohydrate, but in kind of fructose or maltose, but body utilize on form of only glucose. So if inability of glucose of by the human being, it can be excreted in the urine. Normally, urine does not contain a sufficient amount of sugar to react with any popular enzyme or reducing test. The person glucose presence in the normal healthy human being, it should be nil. Absence should be there. If any glucose presence in the urine, that condition is called glycosuria. It may be it may be due to two factors, by the physiological factors or by the pathological factors. Physiological factors, sometimes under physiological conditions, glycosuria can occur. If after large ingestion of carbohydrate, large quantity of if we are taking large quantity of carbohydrate, just rice, we are taking a lot of quantity in both time, to may affect the condition. That is for the physiological condition of sugar, physiological condition of glycosuria. Second one is the anything that stimulate sympathetic nerve system such as excitement, stress. So in stress condition, maybe glycosuria condition may be occur in the human being. 15 to 20% cases of pregnancy may be associated with the physiological glycosuria. If a patient condition is pregnant lady, so in that case, like is presence of glucose in the urine that is normal, but no needed any medication. It is related to only physiological condition. It will be disappear after termination of pregnancy or after completion of pregnancy. Renal glycosuria. In some person, glycosuria is found when blood glucose in is normal range. This is known as renal glycosuria. This is again due to lower renal threshold level. Threshold level is the maximum limit of the sugar in the urine. Usually this is a benign condition. So in that case, physiological conditions are there. Some four conditions are there. Large ingestion of carbohydrate. Second, some sympathetic nerve system like excitement, stress condition, a lot of tension. So maybe glycosuria may be occur, and pregnancy condition, and renal, some blood glucose in the normal range, that is renal glycosuria. So there are four physiological conditions in which glucose may be found in the urine. Next, second condition, this is very most, and we need to diagnose only pathological condition. We need to avoid the physiological conditions any patient. So any condition or patient health, and we need to more counseling during the sample collection. If patient is having any drug, patient is having any special diet, and patient is taking any drug, whatever conditions there should be mentioned in the request form. So we can conclude or we can interpret the result of urine with the patient condition. So first one factor is the diabetic mellitus, the most common condition for glycosuria, diabetic mellitus. This is a metabolic disorder due to deficiencies of insulin. Glucose is not properly metabolized and blood glucose concentration rises. When it is in range of 170 180 milligram per deciliter, glucose start appearing in the urine. So what happened in the diabetic mellitus? That is patient, every human being release every when beta cells of Langerhans release insulin in presence of more glucose. So that can be converted in the other form of glucose like glycogen or other, maybe you try in the normal oxidation cycle. So patient glucose exceed more than 170 or 180 condition, 180 mg per deciliter, then that condition glucose start appearing in the urine. So if patient glucose, if you are testing in the blood serum for the patient, blood serum of patient, and result are glucose 170 to 180 mg per deciliter, so you may check the urine also for the glucose test, and if urine glucose is found in the urine, that is condition you diabetic mellitus. So patient that two type of diabetic mellitus there, insulin dependent or non-insulin dependent is there. That is more we can discuss later, or we can check the another side. Second one is the glycosuria due to other endocrine disorder. Deranged function of the number of endocrine disorder can cause hyperglycemia. Hyperglycemia, urine blood glucose level, normal glucose level 60 to 120 or 140 mg per deciliter. If glucose level may beyond the 180 mg per deciliter, this is a threshold level, and urine glucose level may goes beyond the more 180. That is condition hyper. Hyper is the more than glycemia, presence of glucose. So hyperglycemia, this is a condition in which blood glucose concentration goes beyond the threshold level, and this may result is the glycosuria. Some factors are there due to hyperthyroidism. Hyperthyroidism, more concentration of thyroid hormone in the patient or human being. So due to thyroid also glycosuria may be occur. Hyperadrenalism, some sport person or some people are taking just who any person who are visiting gym or whatever gym for the bodybuilding or for the normal fitness, they are taking drugs or they are taking any food supplements in which they are taking indirectly adrenalism hormone. So due to additive drugs or additive food product, human may be suffer with the glycosuria after some month or year. Hyperpituitarism. This is the also more concentration of pituitary hormone in the person, and some disease of pancreas. Some disease pancreas have all three type of cells, which is most important to regulate the blood glucose, insulin, and glucagon, which is most important beta or alpha cells. And if any disease in the pancreas, due to this disease, alpha or beta cells may be damaged, then glucose metabolism management may be disbalanced and glucoseuria may be occur. So these are two conditions in which first deficiency of insulin and second any type of disorder. So we need to differentiate all the two factors, in which factor is affecting the glycosuria in the patient. You can differentiate the you can see the two pictures of the screen. First one is the normal urine, in which you can see the normal composition, and these are the abnormal composition. You can see this is the crystal clear, and this is slightly clear. You can see the any transparent pigment RBC or pus cells are there, and this is the high proteinuria diet, high proteinuria urine, in which you can see the most turbid sample. You can't see across the beaker. These are number of tasks which need to be done in the chemical analysis of urine. First one is leukocyte. It should be normal, negative, or less. Trace may be indicating UTI disorder. Nitrite, which should be negative, and if it is positive, indicates significant infection. Urobilinin, which should be zero point 0.2 to 1 mg per deciliter, and if it goes beyond 2, may indicate liver issues. And third, next factor is protein. It should be negative or zero, and if trace element may be there, may indicate kidney dysfunction, because kidney function, that kidney need to be reabsorb any protein which is filtered by the glomerulus. No protein should be filter no protein should be excreted through the kidney in the urine. If protein is excreted by the urine, that is some disability of the kidney. pH optimal 7, it should be there. Normal blood pH 7.35 to 7.45 is there. Blood, no blood should be there in the urine. If trace amount of blood cells is there, that indicate of several issues or disorder. Specific gravity, it should be between 1.016 to 1.020. Higher value of specific gravity may indicate dehydration, and extreme or low value is not related to any serious condition. Ketone bodies, which is mostly important. If patient if you are testing any ketone body, if you found any ketone body in the patient or any human sample, that is most metabolic disorder, and due to long fast, just any person who are taking continuously fasting 4 days, 5 days, 6 days, so you can find out the ketone body in the urine. And ketone bodies are most toxic and neurological, maybe work as a neurological disinfectant or neurological damage factor. So it may be damage the neurological condition of the patient, or maybe more harmful. So we need to examine the ketone body also. It should be negative in the patient. Normal serum, normal urine. The third one is bilirubin. It should be also negative, and if trace amount is there, indicate liver or gallbladder issues. And ketone is found, it indicate fat metabolic or diabetic disorder. And very most important, which is most important, glucose, it should be less, negative should be there. If it is allowable concentration 15 mg per deciliter, if concentration of glucose in urine goes beyond the 15 mg per deciliter, may indicate kidney issues, or I already told you it may be due to pregnancy. So glucose spike immediately after large meal is normal, but after 2 hours it should be in normal range. And some drugs, that may be increased bilirubin, alphapurinol, barbital, birth control pills also. Any female is taking birth control pill also. Market is the some birth control pills also. Male also is there. So any couple is taking birth control pill also. So urine concentration may be also changed due to birth control pills. Chloropromazine, diuretics, isoniazid, penjapyridine, steroids, sulfonamides. So these are drugs may be increased or decreased, and some of drugs endomethacin, ascorbic acid, vitamin C, that may be decrease the bilirubin level also urine. And what kind of test which is need to which can be done for the chemical analysis? There is a dipstick test, which is, you can see a example of dipstick in the screen. Urine dipstick is a narrow plastic strip which has several square of different colors attached to it. Each small square represent a component of task used to interpret urine analysis. And just like first part is represent for the glucose, second is for bilirubin, ketone, specific gravity, this for specific gravity. Next one is the blood, thus next is the pH, and next one is the protein, and next is the for urobilinogen, this one for nitrate, and last leukocyte aspirate. So each component of square is presented test which can be interpreted urine analysis. And colors generated by the each pad are visually compared again a range of color on a brand specific color chart. So we the entire strip is how to done chemical analysis by the dipstick method. It is most analysis, most convenient and most easy. Just take a chemical any plastic strip, it dip in the urine sample and color change in the squares are noted with the comparison. How to compare? This is the comparable chart which is labeled on the outside of the box. Box which is this is the box, and you can find out the you can get the many dipstick 20 or 50 or 100 dipstick in a container. So any color changes we can be readable on behalf of the comparable chart. If no color changes is negative, slightly color changes is plus, if more color changes is plus, second 2 plus, more color change 3 plus, more color change. So any concentration of change color is increasing, that meaning the concentration of required given component is increasing in amount. The sugar may be found in plus 1, plus 2, plus 3, plus 4, and also bilirubin, ketones, blood cells may be found in plus 1, plus 2, plus 3 in format. So we can analysis by the chemical component of the glucose by the dipstick method is various easiest method, and all laboratories are using this method for the chemical examination of the urine, because all the tests need, if I perform all tests by one, it will take more time. But by the dipstick method I am taking done we can test within 2 or 3 minutes all the tests. So second part which is covered, and in this test you can find out the chemical exhibition of urine. So some factors are there. If patient urine is founding, if patient serum, so patient urine having any protein and glucose, if glucose found in the urine, that condition is glycosuria. If found is protein in the urine, that is condition of proteinuria. So some conditions are called, and this is the test method in which way we can test the chemical composition of the urine. Any break or any changes? So we can go ahead in the third part. Hello.
Sir, we can start with the third part.
Yes, ma'am.
Meanwhile, I will request the participants to place their queries on the YouTube while the sir starts with the third part of the training. Dr. Vikash, we can start.
1 minute, ma'am.
Dr. Vikas, there is one question that I'm putting up.
Yes, ma'am.
One person has asked, tell us about the test equipment we use to test.
Okay, I will discuss in this section. We need to. I have already told you कि we need to we should have a container for the collection of sample and any other instrument required for the physical examination of urine and chemical examination of urine. Chemical examination of urine, we need to have only dipstick box which is shown in the chemical examination pattern. This way, this dipstick is required for the chemical examination. Now, third part will cover more important and that require more amount of more number of instrument or more number of lab apparatus. So, may I go third part, ma'am? So, this is the third part of urine analysis, microscopic and urine analysis. Microscopic examination used to view elements that are not visible without microscope, just like RBC and whatever cells are there. So first, I am telling you how can we ready a slide this kind of way. So we need to a each laboratory should have a centrifuge and lab centrifuge tube and other requirements of laboratory. So and microscope which is availability on the lab and slide and cover slip also should be there. So first we collect the sample in the patient container and after collecting of the patient container collection of urine, urine should be transferred in the centrifuge tube and we need to centrifuge the urine according to SOP. Somewhere we use 3000 per RPM for the centrifugation. Some laboratories are using 20,000 RPM. So we need to use around mid value 5,000 RPM. We can centrifuge the sample and after centrifugation you will get two parts, supernatant and sediment. So supernatant part of urine should be transferred in another test tube and sediment part of urine should be transferred on the clean cover slide and place a cover slip on the sediment sample and we can fix under microscope and we can examine in the low power. So already if you are using any microscope, so there are three component are there: low power index, high power, and OL immersion index. So we need to examine under 10x and 10x objective and 10x eyepiece also. The first part we need to examine the microscope examination. So I have already told you how to centrifuge the sample, how to prepare the slide for the microscopic examination. So first centrifuge the sample with the help of centrifuge and other apparatus and transfer only sediment part, not the whole supernatant. So above part of supernatant which need to be transferred in another test tube and sediment part should be transferred in the clean slide and place a cover slip on the sample and we can examine under low power field. First part RBC. If any RBC is present in the urine, that is abnormal condition, and that is called hematuria. If RBC is present in the urine, that condition is called hematuria. It may be found due to glomerular damage. Glomerular also I will explain what is glomerular. Glomerular is the part of nephron. It may be due to tumors in the any part of human body or any part of urinary system, and urinary tract stones. So any stones which is in the ureter, which is in the kidney. So this factor, due to this factor, maybe RBC may be found in the urine. Upper and lower urinary tract infection. So upper and lower. So kidney infection, just like various type of infection in the kidney. So due to these infection, RBC may be found in the urine, and lower tract infection may be how occur lower urinary tract infection. Maybe we if a human being is using any infected toilets or any habits, any other habits, so maybe get infection from other patient or other human being. So these are some factors in which RBCs may be found in the urine, which is abnormal condition. I have already explained. The RBC presence in the urine should be negative, nil, your absence. There are two types of hematuria may be seen. First one, if you are clearly can see the RBC color is the red, that is gross hematuria. It means that blood can be seen by the neck rise. The urine may be a low pinkish or brownish or bright red. So that is called gross hematuria. If second one is the microscopic hematuria, it means that the urine is clear but blood cells can be seen under a microscope. So though two type of hematuria may be seen and factors are remain same. So this is the condition. We can identify the gross hematuria. This in first one condition, you can clearly see the RBC's red blood, red urine. You can see the clear RBC presence without use of microscope. In second condition, you need to help the microscope to identify blood cells or see. And these are blood cells which can be seen in form of, this is the microscopic field. Second one, these are real pictures. RBC may be appear normal shapes swollen by diluted urine. These are RBC shape, but in normal urine, when we examine under microscopy, so these type of round shape are visible in erythrocyte form. These are RBCs which can be visible in the microscopic examination of urine, and these are also colorless. These are normal shape should be there. Second one is the white blood cells, and normally we can use pus cells also in another terminology. White blood cells also is the pus cells. Pyuria refer to the presence of abnormal number of leukocytes that may appear with the infection in either upper or lower urinary tract or with acute glomerular nephritis. So acute is the condition is the starting condition, and chronic, that is later on 15 days or 20 days or 1 month continuous infection is there, that is called chronic. Acute is starting infection, and the chronic is the severe infection or later on continuous infection. WBC are granulocyte, and it should be 2 to 5 high power field. HPF is the high power field, and high power field is the 40x, and low power field is the 10x. So 10x is the objective lens, and 40x we can change the lens of the microscope according to condition. The pyuria, any pus cells is found in the patient urine specimen, that is called pyuria. Any RBC found in the patient specimen, that is condition is hematuria. This can be seen in normal picture. You can see the normal WBC in the patient urine microscopic examination. And this is the broad picture, which is another microscope. And this is the normal. You will see like this microscope. Next is the epithelial cells. Renal tubular epithelial cells contain a large, round or oval nucleus, or normally slough into the urine in small numbers. However, with nephrotic syndrome and condition leading to tubular degeneration, the number slaughtered is increased. Epithelium cells normally excreted out the human body and it may be normally seen, but number of epithelium cells are increasing in the urine specimen. It will directly related to nephrotic syndrome or either infection. It may if epithelium cells found in the urine is normal 2 to 4, 2 to 6, that is normal. It should be present in the epithelial cells in the urine. But number of epithelial cells are increasing in the patient urine, so that is directly related to the nephrotic syndrome or either any infection. How epithelium cells are appear in the urine specimen? So these type of specimen irregular shape, and you have already seen RBC and WBC in the visible form. Epithelial cells are visible like this one. You can see the irregular shape and large shape and 7 to 8 micron size the WBC, the RBC 10 to 12 micron size the WBC, and more than 25 micron size the epithelial cells. Next factor is the cast, which can be seen in the microscopic examination. Urinary casts are cylindrical structure which can be produced by the kidney and present in the urine in certain disease state. They are formed in the distal collineated tubules, already distal and proximal. Distal away from the collecting duct and proximal is the nearest to the proximal, near to the glomerulus. Any part, this is a terminology we use in the anatomical condition. Proximal near to the end and distal away from the end. The distal convoluted and collecting duct of nephron then dislodge and pass into the urine where they can detect any microscopy. Urinary cast may be made up of cells such as white cell cast, red blood cell cast. So this is the chemical composition which in that case any cells may be trapped in the cast that is called for the RBC cast, WBC cast, whatever type of cast which is trapped in the cast. I already told you is some distal connective tubule. PCT is there. This part of nephron is called PCT, which is near to the glomerulus, and this part is away from the glomerulus, so it is called distal connective tubule. So you can see the greenish side. So this is the cast, and this is a specific protein which can be tested. What kind of factors which favor protein cast formation? Low flow rate of filtrate. If blood pressure is low and flow rate or is low, then urine cast can be formed. High salt concentration. If our daily habit is those person having taking high concentration in the diet, normally a lot of person use takes salt after delivery or after taking the drug. So second and third one is the low pH. So that is also most important. If urine pH is low, then patient urine may be found any cast formation. All of which were protein denaturation, precipitation, particularly to the Tom Harspool protein, which is named. So any person producing Tom Harspool protein, definitely they will form any protein cast. Protein cast with long, thin tail form at the junction of the Henle loop and the distal collineated tubules are called cylindroids. Hyaline cast can be seen even in the healthy people. So these are factors. Due to these factors, a specifically protein produced by the human system, which is denaturation or precipitation form of any protein. So this condition is Tom Harspool protein, and it can be form a specific cylindrical structure, and it can be block the urinary filtrate just like this. So these are sort, you can see a small dot of cast, and this is the combined cast formation. So this can be this can be visible in the urine microscopic slide. You can see any other type of cell. So you need to identify any type of cell, any type of cast in the microscopic examination. How it affect? Iron casts are composed primarily of mucoprotein, Tom Harspool protein, secreted by the tubule cells, and these proteins secrete green dots illustrated in the diagram below, and forming a hyaline cast in the collecting duct also is there. Red blood cells may stick together and form red blood cell cast. I already told you any type of exciting cell which is trapped in the cast, that is called specific cell cast. Such casts are indicative of glomerulonephritis. This is a type of infection, glomerulonephritis, with leakage of RBC from glomeruli. So normally, no RBC can be filtrated by the glomeruli. If some RBCs are filtrated in the urine, that is infection in the glomeruli, which is called glomerulonephritis. And same like white blood cells may not be filtrated, but if presence indicate inflammation of kidney because such cast will not form except in the kidney. So these white blood cells are filtrated in the urine, also trap in the cast and maybe form any specific white blood cell cast. So you can see the picture, real pictures of cell cast. So any this is a white blood cell cast. So in what is there? A lot of protein is there, and a lot of protein cast. Some white blood cells are trapped and they are fixed in the cast. And this same happened with the RBC cell cast. In protein, they form a cast, and during excretion of RBC from the glomeruli, these RBCs are trapped by the cast and they are fixed in the RBC cast, and they are fixed in the any part of human sorry urinary system or urinary bladder. They may fix in the urinary bladder. A lot of RBC, you can see the real pictures of RBC which can be identified, should be identified in the microscopic slide. And this is the hyaline cast. You can see the light cylindrical structure, which can be large structure, and you can see a lot of small cells are trapped inside the cast. This should be identified in the hyaline cast. Another microscopic slide, which can be seen, and in this case, RBCs are trapped in the cast, and this is called as a red cell cast. Same white cell cast. Another diagram of cell. Benzone protein. These are small protein found in the urine. Testing of these protein is done to diagnose and monitor multiple myeloma. Multiple myeloma, already you know about it. Multiple myeloma, this is the type of cancer, various organ cancer. So it is collectively called multiple myeloma. So if this benzone protein presence in the urine may be diagnosed, this patient is suffering from multiple myeloma. And other disease, so benzone protein are considered the first tumor marker. So also benzone protein test, if anyone having doubt he or she having any first stage of cancer or not, so may test this multiple myeloma test for tumor benzone protein. It is, what is tumor marker? It is a substances made by the human body that is linked with to certain type of cancer or malignancies. Benzone protein are made by the plasma cells. That is type of white blood cells also is there. So this is normal function. The presence of these protein in a person urine is associated with the malignancies of plasma cell. So we can test the various type of tumor marker through the urine test also. So a lot of protein found in the urine. If patient is suffering from the multiple myeloma and the cervix cancer, uterine cancer, breast cancer, throat cancer, any type of cancer is there. So you can see the benzone protein multiple myeloma cast from the urinary segment in related patient. So this is the corporate picture for the clinical investigation, and this picture examined under 200x. All the part has been completed. So all three part component are there. I'm again revising the all urinary examination. First, what is the objective of urine analysis? This examine. These objectives are there. We can guess the abnormality that indicating disease condition of infection. We can detect stage of disorder related to urinary tract infection, kidney disease, and diabetic also there. And any appearance, any concentration, any type of abnormality of urine may be related to any disease. And a person starting your queries there, what kind of apparatus and what kind of laboratory apparatus we need you have in laboratory. So we don't need any specific requirement. We need only we should have a urine container which can be given to the patient for the collection, and test tubes are there in laboratory, centrifuge and microscope is there, and slides, microscopic slides should be there, and cover slip and other. These are minimum requirement for the test urine analysis microscope examination. Urine, and this is the part I conclude how to form the urine. Both kidneys filter 180 liter ml 180 liter of blood in 24 hour, and after 24 hour they produce only 1.5 liter 178 liter of human blood what can be utilized by the human body. It can be reflected, and all urine form which can be collected in the bladder and which can be excreted when we feel the bladder is full. So we can, this is sphincter muscles which control the urination. This is the diagram of nephron, in which you can see the how the urine formation, how urine form. This is the pathway of filtrate. So blood come from this side and filter out, and fresh blood come from this side, and all filtrate goes down this side, and Henle loop and proximal tubule. These are part component of nephron. These have specific functions. Some part having absorbing blood, sorry, absorbing water component, some part absorbing any nutrient component from the filtrate, and after the passing of the distal convoluted tubule, all the waste product collecting pass the through the collecting duct, and these waste product collect in the bladder. This process continuous work 24 hours. This is the, I already told you, this is normal composition of urine and abnormal composition of urine. And these are some factors which can affect the composition of urine, in which first will diet and nutritional status, ability of kidney function. This is the collection and preservation of urine specimen, urine container, type of specimen. There are various type of specimen we need to identify according to the test in which type of specimen we need to collect, and we need to instruct the patient. Patient instruction are also detailed in there. For the newborn is there, female patient instruction for female patient are there, and first instruction to the, or first or last instruction to the patient, your sample should be not contaminated, should be fresh, not contaminated. So any contamination there should be washed before collection. So first morning sample for the specific test, and various laboratory we use only first morning sample. Random specimen never use, we should not never use, and second order sample may be used for the specific test. Postprandial sample may be used for the glucose tolerance test and glucose challenge test, and 24-hour specimen test may be defined for particular purpose. And midstream urine sample which is mostly accepted. So two type of specimen mostly accepted. First one, first morning sample, and midstream. Midstream urine for the routine microscopic. If you are collecting urine specimen for the only for RM, routine and microscopic, collect midstream specimen. If you are collecting sample for the culture and sensitivity, this is the another type of examination. So first you need to collect first morning specimen only. Clean catch urine sample, or this is applied for only admitted patient who is not, who or she who is unable to sit down. This is the procedure I already explained, how to collect the 24-hour urine collection, and what should be labeled on the container, and why we need preservatives. If when we need preservatives, when test around time is beyond more 2 hours or more 4 hours, then we need to use preservatives. Either we ignore the preservative methods. There are two type of method: physical method, chemical method. Their refrigeration and the chemical method is there. These are alternative. You can differentiate between all the methods, advantage and disadvantage. Most advantage method. You can select any type of method as per the test requirement. These are the type of examination which can be done in routine urine analysis: physical examination, chemical examination. Physical examination can be done by the human eye or human eye only, naked eyes. For the pH testing, we can use the pH paper, and odor we can feel, we can smell, or color we can color of urine we can examine through the color appearance. Specific gravity, we use the specific gravity meter also there. Volume we can define. For the chemical examination, we can examine through the depisting method. A microscopic examination of urine can be done by the microscopic examination of sediment of the urine. Not for the directly, we should not use directly any specimen for the microscopic. We need to centrifuge every patient's urine for the microscopic examination. And these are some parameters we need to examine under microscopic examination. Any type of bacteria, any type of yeast, any type of parasite which can be found in the urine specimen. So any type of parameter which can be found in the microscopic examination. These are categories of urine tests, and these are some parameters which need to be examined under physical examination of urine. The such as urine volume, 30 ml, how much volume you have collected, color of urine, what color is there. So color of urine we can we differentiate, and we need to mention appearance is clear. What is urine color? Black color urine is there, yellow color is there, red color is there, green color of urine there. We need to mention only color of urine is there. Specific gravity we can check the instrument, specific gravity meter, and pH we can check by the pH of the pH paper. Yeah, pH meter is there as per availability. pH paper also is there, and pH meter we can define. These are some causes. Due to these causes, urine may be acidic or alkaline. This chemical some parameters are there in chemical analysis. Mostly parameter glucose and protein. So these parameters can be tested by this depisting method. Depisting method is very convenient method and easy to use. No need to perform individual tests. Perform all the tests in one time. Thus, dip the all urine depisting in the sample properly and put out after 1 minute or 30 seconds. Only 30 seconds. After 30 seconds, if any constant will be present in the urine, the each square color change will be changed according to concentration of urine. If no constant is present in the urine, no color change of dipstick any square. And if any change appear in the any square, you can compare with the compare chart and you can report this color, this patient having any constant protein, sugar, or any blood or specific gravity, ketones, and plus one concentration, nil percentage, any one condition is there. Third part, microscopic examination. So we need to centrifuge sample before the microscopic examination and put under the cover microscope, under the microscope with the cover slip, and first examine under low power field, and then later on after fixing of the slide you can use the high power field, which is 40x. And these are some parameters I already explained. RBC should be examined, and how RBC is appearing in the microscopic field. So this type of appearance can be seen in the microscopic picture. White blood cells also may be there, so it should be appearing like that. And epithelial cell, it should be appear like that. So three types of cells are most important, and some part of you can find out any stone also there in the pictures there. So we can, if patient is if you are found any stone in the patient urine, go for the confirmation test. The patient suffering from any type of stone is there, maybe kidney stone, maybe gallbladder stone is there. So patient should be examined under any radiological examination. So stone is also tested in this criteria. Thank you. All examination has been completed. Any question?
I think the first part of the training is over, and I can see some questions.
Yes,
so
ma'am.
just let me ask that one. Good morning, sir. Can we use dipstick for quantitative analysis of substances?
We use in what manner? We are using in plus one concept. Basically, we use depisting method in qualitative purpose only, because depisting method define only range of specific constant. Just like plus one it defined is a 50 to 100 mg per deciliter, just like plus to 50, 100 to 150. In quantitative, we can use two way. First, confirmative exactly, or we can in qualitative we can define in range only.
Okay. I would request the participants to please place your queries on the YouTube chat box. Meanwhile, I would request Vikashi to take at least 15 minutes break because since morning he's taking session continuously. So, sir, we can meet again at around 12:05. No, not 12:05. I think 12:15 we can come and meet again for the trading session
For the second part.
for the second part. And the participants, please don't log out. We will be back again for the training at 12:15. And till then, I would request sir to please, we can go on mute and close our screens. But you please keep on placing queries on the YouTube chat box. Once we come back at 12:15 p.m., we will start with the I will start with your questions and then the session will start. Thank you. Dr. Gaur, are you there?
Yes, ma'am.
Shall we start?
Ma'am, 5 minutes we can take.
Sure, 5 minutes more. Okay. Meanwhile, the participants are requested to put their queries on the YouTube chat box. We will be starting in another 5 minutes, so 12:20.
प्लेटलेट के लिए क्या करना है? प्लेटलेट डायलेटिंग फ्लूइड, रीस एक्कर फ्लूइड। आरबीसी के लिए कौन सा फ्लूइड लेते हैं? आरबीसी के लिए सर आरबीसी के लिए ही रेसेकर लेते हैं। रेसेकर प्लेटलेट के लिए यही।
सर, आपका माइक ऑन है?